As Gandhi said, it is health that is real wealth and not pieces of gold or silver. And he also went on to say that without good health, life is not life, but it is a state of languor and suffering. And in this motion, we are dealing with patients who are trying to maintain good health or eradicate bad health. So in both physical and mental, and in many ways, we're dealing with very vulnerable people at every age of the spectrum. Minister, 2 years into this government, we're still seeing inadequate delivery of services, and I have to say, a lack of urgency on the part of those in charge. Outpatient waiting lists have hit record highs. More than 10% of our population are waiting, and many for more than a year. Emergency department overcrowding last month saw its highest ever on record, and that's 30% higher than last year. There are major delays in accessing community health services, especially for children. 6,181 children are waiting for a primary care psychology appointment, and of these 25% are waiting for more than a year. And this is in a time when we are saying that we care more about mental health than we ever did before. There's a 10% increase in children waiting for a CAMHS appointment. There's a GP crisis. There's 4,312 children with disabilities awaiting their statutory right to an assessment under the Disability Act. And almost 10,000 children are waiting for an appointment in our children's hospitals, many of these for more than 18 months. And that's before I even touch or get into the scandal of the cervical screening scandal, which is a scandal. But apart from that, the management of it since it has been uncovered has been absolutely shambolic. Minister, the women of Ireland are enraged. Their families are disappointed, frustrated, angry. And every day, questions remain unanswered, and more questions among more questions. The system that was put in place in terms of a call centre has been absolutely disgraceful. A friend of mine who rang the first day, rang the fourth day, rang the fifth day, who had had an abnormal showing, was told twice that somebody was looking at her case and somebody would get back to her. And nobody to this day has gotten back. So women are really worried and they can't sleep at night, and we absolutely have to do better. Make no mistake about that. We need reform, and we need it straight away. We need it for patients, and we need it for the wonderful people that are at the coalface of our medical and health system. Thank you.